Thank you. What if I told you that all the noise that you hear about healthcare in the news only accounts for 20% of the problem? When you actually look at what allows us to live longer lives and higher quality lives, only 20% of that can be explained by what happens in a hospital or in a doctor's office. So what about the other 80%? Where is that? We know that 10% of that is accounted for by factors in your physical environment. 30% by the health behaviors you make, as well as those that your environment helps you shape. And 40% are from social and economic factors. These include the jobs that you have or don't have, and the social groups that you're around. So let's get back to this 20%. As a physician, I know that most people spend only hours in a doctor's office or in a hospital during a year. As a systems scientist, I ask myself a basic question. Where's healthcare and the health system for 99% of your life, where you live, work, and play? For the last 8 years, I spent time working across sub-Saharan Africa, working in communities that live in extraordinary constraint of cost, consequence, and distance. And from that, I found an extraordinary but simple and powerful solution that's emerging. Train people in their communities to take an active part of their healthcare outside of the walls of a hospital or clinic. This is an idea that has been around for 40 years, longer. But over the last 10 years, we've seen a revolution in the ability to put mobile phones in people's hands, give them rapid diagnostic tests, and arm them with protocols that turns an informal network into a scalable system that over the next few years, we anticipate 1 million community health workers to be across sub-Saharan Africa. This isn't just in Africa. Go to India, Latin America, all across the world, and you're seeing a rise of community health workers. So what can we learn about a group of people that treats conditions like malaria, pneumonia, and diarrhea in the United States, when our issues are around diabetes, depression, and dementia? What we found is that there's a basic circuit of health which is common across all these locations. The first and most important is just staying healthy. Staying healthy is not a passive process, it's active. What you're doing with me here today is an active part of you staying healthy, just as much as you going to your schools, interacting with your communities. But when you get off balance, you start showing symptoms that something's going wrong, and those are not always easy to figure out if they're serious or can pass by. If somebody has a fever, it could be a passing cold. Otherwise, it could be the sign of an impending serious illness. Let's take a less trivial example. Imagine that an elderly woman stops paying her bills. Is this a sign of financial delinquency? Or is this the onset of dementia? And how do we respond? Credit score or reaching out? Then we have to figure out, if it's serious enough, where do we go? What's the right setting for care? Do we go to Google, your neighbor, a doctor, or an emergency department? That's $1 billion of confusion and waste that we have in our health system because people don't know where to go. Treatment is more familiar. In treatment, we have 50 years of innovation behind us, but when those investments leave the hospital, we have self-management for the rest of our lives. We've taken this basic circuit of health and used community health workers to link together all of the pieces in communities along with clinics. And we've implanted it into settings like Harlem, New York, where I live. We've set up a learning environment with institutions like health insurance companies, hospitals, the community itself, and a social enterprise called City HealthWorks to start asking the basic questions to build for the 99%. And along the way, we found 3 major problems that our group is interested in. One is that we know so little about how people set goals and get motivated in their own environments, and how do we actually help people reach them? Second is, if we're going to build for the 99%, we need an infrastructure that matches. And it can't be the clunky infrastructure that we know about from the health system. We have networks and mobile phones that allow us to build for a new, flexible, and agile health system. Finally, cost and impact are as important as they ever were before. But we have new tools in hand. We know where people live, how they're behaving, and where we can invest for prevention in more strategic ways in a real-time manner. It's hard to imagine all of these things coming together for systems transformation in the US. What I'd like you to do, and I mean this sincerely, is to actually come and visit us in East Harlem and to see and talk to the people that are making systems change happen instead of listening to the noise about what could happen. Can't come all next week, but I want you to start scheduling with me, and I'd love to take you around. Thank you.